You have noticed some medical records are incorrect, causing you clinical or financial nuisance. What is your right? How does it work? Are there tips to help you along? Welcome, I am the medical bill whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to patients like you. Under the HIPAA law, patients have a right to request corrections and amendments to their medical records. This is called the right to amend. How can incorrect medical or demographic data, wrong insurance information, or incorrect medical records can affect you? Well, incorrect demographics or insurance information will lead to payment delays or even denials. Charge coding can also be affected with subsequent underpayments or incorrect claim processing. But clinically can also become an issue with duplicate services, tests, labs, and clinical errors. For example, interaction between prescription drugs. As for incorrect or missing medical information, don't forget, it could also negatively affect the consequences, for example, for obtaining or keeping a job, applying somewhere for benefits, or even legal action. Medical record errors or omissions cost you money. So how does it work? There are different steps. The first one is to review your medical records for potential errors, especially after you receive a denial explanation of benefit. You can use the provider or hospital portals to correct or update demographic information, for example, your date of birth or your new married name, as well as update insurance information with your new plan's ID number. You can request in writing medical records to be sent to you. Contacting your insurance is helpful. Ask, why was the claim denied or underpaid? How was it billed in the first place? Does it show this was an emergency? Is this the correct diagnosis code? What level of care was submitted? Contacting the provider is the next step. Do so through the portal message center, if there is one, or through a regular way of communication with an office. Remember, in writing is a must. Indicate the specific information or doctor's note that needs amending. What do you request be amending and why should it be corrected? Indicate the legal 60-day deadline for a response has now started, as the date of your request and your signature indicate. If this is an error that must be corrected through a hospital or facility, same references to the info that needs amending, same reasons why you are requesting it, the date of your request and your signature will be necessary. And the 60-day deadline also applies. You should not be surprised if that request is denied. Two main reasons. Doctors don't like to admit wrongdoing or errors. Second, the biggest one, it's a fear of malpractice. If they agree with you that they were wrong, they open themselves to legal action. A statement of disagreement is then the next step, and that is what will eventually be added to your medical records, showing your side of the story. Other actions on your part can help out. The easiest one is to correct demographics and insurance updates through the portal or directly with a billing department or service. Do follow up with the insurance to make sure an updated or corrected claim has been submitted though. If or when a change of clinical record is denied because doctors don't like to be wrong and fear malpractice applies, express your unhappiness. You could go all the way to the state's medical board or state's Department of Health. But first, I would suggest contact your insurance and file a grievance if that provider is contracted and in-network. They are special forms. Don't file an appeal, file a grievance. Not the same thing. If a provider is within a medical group or within a hospital, there should be a specific form you can file. The patient satisfaction department, patient advocacy department, or the patient grievance or complaint department should be indicated on the website. And don't forget, how did this error and refusal to correct it affected you, and what you still wish would be corrected now. So the complaint or grievance department may not have much of an authority over the medical records department or provider's actions. You may see a reduced bill, a complete write-off, and certainly an apology in return. As for bad outcomes, should that occur, all these steps you have undertaken will help you and your attorney build a strong and hopefully successful case against that provider. I so thank you for watching. Don't forget to like, comment, or subscribe. It helps this little channel grow a little bit more to reach out to more patients just like you. So thank you.